Amcinonide cream is used to treat different skin conditions like eczema, dermatitis, allergies, and rash. It helps to reduce swelling, itching, and redness that can occur with these conditions. This cream is a strong corticosteroid. It is important to use it as directed by your doctor. Apply a thin layer of the cream to the affected area, usually once or twice a day. It is best to use it at the same time every day for the best results. Now, let's talk about how to use Amcinonide cream. It's important to apply this medication only on the skin, and not on the face, groin, or underarms unless your doctor tells you to. Before applying the cream, make sure to wash and dry your hands, and clean and dry the affected area. If you're using the lotion, shake the bottle well before using. Then, apply a thin layer of the medication to the affected area and gently rub it in, as directed by your doctor. This is usually done 2 to 3 times a day. Avoid covering or bandaging the area, unless your doctor tells you to do so. After applying the cream, be sure to wash your hands, unless you're using it to treat your hands. If you're applying it near your eyes, be careful to avoid getting it in your eyes, as it can worsen or cause glaucoma. Also, be careful to avoid getting the medication in your nose or mouth. If it does get in these areas, rinse with plenty of water. Remember to use this medication only for the condition for which it was prescribed, and not for longer than prescribed. If your condition lasts or gets worse after 2 weeks, be sure to inform your doctor. When using Amcinonide cream, you may experience burning, itching, irritation, or dryness at the application site. These effects should go away after a few days as your body gets used to the medication. If they persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the risks. Most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience stretch marks, skin thinning/discoloration, acne, extreme/unwanted hair growth, or small red bumps on the skin, folliculitis. Also, be aware that skin infections can worsen with the use of this medication. If redness, swelling, or irritation does not improve, contact your doctor. In rare cases, this medication can be absorbed into the bloodstream, leading to side effects of too much corticosteroid. These are more likely in children and in people who use the medication for a long time or over large areas of the skin. Contact your doctor right away if you experience unusual/extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Before using Amcinonide cream, make sure to inform your doctor or pharmacist if you have any allergies, especially to corticosteroids. This cream may contain inactive ingredients that can cause allergic reactions. It's important to also discuss your medical history, especially if you have poor blood circulation or immune system problems. Avoid using this cream if there is an infection or sore in the area to be treated. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress. Before any surgery or emergency treatment, inform your doctor that you are using this medication. If you are using this medication on a child for a long time, it may temporarily slow down their growth. Make sure to see the doctor regularly to check your child's height. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is unclear if this medication passes into breast milk when applied to the skin, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Amcinonide cream, as they could affect how the medication works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without getting approval from your doctor. This will help ensure the safe and effective use of Amcinonide cream. If Amcinonide cream is accidentally ingested, it can be harmful. If you notice someone has overdosed and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. Remember, you should not share this medication with others. This medication has been prescribed specifically for your current skin condition. Do not use it for other skin problems unless your doctor tells you to do so. In those cases, a different medication may be needed. Your doctor may need to do lab or medical tests, such as checking your adrenal gland function, while you are using this medication, especially if you use it for a long time or over large areas of the body. Make sure to keep all your appointments with your doctor and for any medical tests. If you have any questions, consult your doctor for more details. If you forget to use the cream at the scheduled time, apply it as soon as you remember. If it's close to the time for your next dose, then just wait and use the cream at the regular time. Do not apply double the amount to make up for the missed dose. Make sure to store Amcinonide cream at room temperature and do not freeze it. Keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.